With the arrival of hurricane season, area hospitals, including Baptist Health of Northeast Florida, are making sure they're ready should a storm approach. At the Baptist Medical Center on the South Bank, this classroom is transformed into an emergency operations center when tropical storms or hurricanes threaten Jacksonville.
We'd make sure everything was in operational order about 4 days out, and make sure we have all the plugs working, all the computer lines, all the phone lines are working, we have the equipment. The phones will be put out, the chairs will be set up, and the tables will be arrayed the way it's set up for the command center.
Andy Sykes, the man in charge of the Baptist Emergency Operations Plan, says the medical center downtown is built to continue operations during most severe storms. For example, patient rooms and most services are on the upper floors should flooding occur. Power backups are at the ready with emergency generators and backup feeder lines from JEA. But one thing Baptist stresses, in the event of an emergency, hospitals cannot afford to act as shelters since their number one priority is to care for the injured and ill.
During such an event, we're going to be doing our best to restrict the number of people we have to care for here in the hospital. Not so much the patients, but also the staff and other non-patient people who may be in the hospital. What we would recommend for people who think that a hospital might be a alternative shelter for them, if they do have a special need, be it mobility, some type of disability, or an illness, or the need for an uninterrupted source of electricity, they need to register with the City Special Needs Program ASAP. Get on that registry. The city and the Department of Health will triage their needs and assign them to appropriate shelter, and that includes providing transportation.
Baptist coordinates its efforts with city and state agencies. If residents from another part of Florida needed immediate medical care, Baptist would work with other emergency operations agencies to coordinate those efforts.
We also have a regional agreement among the hospitals in Northeast Florida under the First Coast Disaster Council, which is our homegrown disaster planning group, that all of the hospitals are talking constantly during this period. So if we can identify a need that another hospital can meet or assist with, we can do it regionally. We don't have to take it outside the region.
To learn how you can prepare for hurricane season, track tropical storms and hurricanes, plus learn how a hurricane forms, visit jacksonville.com/hurricanes. Reporting from the Baptist Medical Center on the South Bank for jacksonville.com, I'm Bill Bortsfield.